Hello everyone, my name is Inkiru from the Aren Couple Diaries, and today I'm going to be talking about hypertension. Now, what is hypertension? Hypertension is simply high blood pressure. Now, there are different stages of high blood pressure. It ranges from the normal blood pressure to hypertensive crisis. The normal blood pressure is usually categorized as any blood pressure that is less than 120/80. Now, when you call hypertensive crisis is when the blood pressure is above 180/120. Now, there are two types of hypertension. We have the primary hypertension and the secondary hypertension. The primary hypertension is usually idiopathic. What this simply means is that the cause is usually unknown. It cannot be cured, but it can be controlled. Now, for the secondary hypertension, is usually caused by other underlying and pre-existing conditions, such as diabetes, renal failure, even pregnancy, because some people have increased blood pressure in pregnancy, and some medications too can cause it, just such as oral contraceptives. Okay, it's a side effect of an oral contraceptive medication. Now, what are the signs and symptoms of hypertension? It's usually asymptomatic. There's some people that don't have any signs and symptoms of hypertension, and this is usually called the silent killers. Now, other signs and symptoms are increased blood pressure, just as the name says, blood vision, headache, chest pain, and nosebleed. Okay. Now, there are also risk factors and causes of hypertension. That's what are the main causes of hypertension. Now, for me, like I said for my previous videos, I always like to use mnemonics. And I remember this using the mnemonic pressure rises. Okay. Now, the P stands for physical inactivity. The R stands for race, mostly the African American race. The E stands for excessive salt intake. The S stands for stress. The other S stands for smoking. The U stands for unhealthy diets, usually increased cholesterol and decreased fiber diets. The R stands for renal disease. The E stands for excessive alcohol and caffeine intake. The other R stands for relatives, that's family history, because if someone's parents or grandparents have hypertension, the person is at risk of developing the condition. Now, we also have increased age. So as you're advancing in age, you're at risk of developing high blood pressure. We also have sleep apnea, elevated weight, that's obesity. Obesity puts someone at risk of developing high blood pressure. And we also have diabetes, that's sugar. Okay? Now, what are the nursing interventions? What can you do as a nurse to assist the patient to control hypertension? Now, you assess and monitor the blood pressure. You also have to monitor the patient's weight. Then you have to educate the patients on diet and lifestyle modification, such as decreased sodium intake, smoke cessation, exercise, decreased alcohol intake, and weight reduction and maintenance. Now, there are medications that the doctor can prescribe for the patient that has hypertension, and those are the pharmacological interventions. I always use mnemonics, so I remember this using A, B, C, D, D. The A stands for ACE inhibitors, the B stands for beta blockers, the C stands for the calcium channel blockers, the D stands for digoxin, and the other D stands for diuretics. Now, if high blood pressure is not well managed, it can cause complications. Now, these complications occur because the excessive pressure in the blood vessels can lead to breaking or tearing of the rupture of the blood vessels. It can cause congestive heart failure, stroke, renal failure, and visual changes. I hope this is going to help someone. Thank you so much for listening. Don't forget to like, don't forget to share, and don't forget to comment. Thank you so much. Bye.